Okay, we're going to go ahead and continue with the assessment of the cranial nerves in this video. We had just begun to go over the cranial nerve number 5. There's just a couple of new assessments that we needed to do. So we're going to ask our patient to go ahead and open his jaw, and then try to put pressure and resistance and have him continue to open it to make sure that that cranial nerve 5 is intact. Then, lastly, what we're going to do is you're going to use your cotton once again, and you're going to depress the lower eyelid here, and then you're just going to swab over and make sure that he blinks whenever you do that. So that pretty much completes the assessment of the cranial nerve number 5. Then we're going to go into cranial nerve number 7, and this one is the facial nerve that we will be testing. So what we want to do in this case is basically have him make a whole bunch of different types of facial expressions. So we're going to ask him to go ahead and open his eyes and lift his eyebrows as if he's excited, and then we're going to ask him to go ahead and frown, and then we're going to go ahead and ask him to show us his teeth, and then we're going to ask him to blow out his cheeks, and then we're going to ask him to go ahead and tighten his eyes up really tight, and then have him tighten it while we're trying to put resistance to try to open them. So that completes the assessment of cranial nerve number 7. Now we're going to go ahead and go into cranial nerve number 8. Now in this one we're actually testing our hearing, the acoustic nerve, and also the balance, but you can test that whenever the patient is walking in and out and you see them generally when you first see them. So in this one we're actually going to use a tuning fork, but in this case, since we were not able to have one here with us right now, we're going to go ahead and just use a regular kitchen fork. And what you'd want to do is you want to go ahead and hit it with your index finger so that it begins to vibrate. And then what you do is you go ahead and put the bottom of the tuning fork here on the mastoid bone here. And then you ask the patient to tell you whenever he does no longer hear the sound, and then you're going to go ahead and set it on the side of his ear. So you would put it here, and then you would set it here, and then ask him when he finishes hearing that sound. So air normally takes longer than the bone, so you should hear it about half of the time longer when you put it next to the ear there. And that's what we call the Rennie test. So, and the Weber test is the next one that we would do, and you would go ahead and hit your finger on that tuning fork again so it begins to vibrate, and then we want to center it at the middle of the head to where the vibration's lateral to each side of the ear, and he should be able to hear it, and he should hear it bilaterally, okay? An abnormal finding would be if he only heard it on one side and not the other. And then we're going to go ahead and do a whisper test. So basically you put one finger anterior to the tragus, go ahead and close that flap, and then you go ahead and whisper something into the patient's ear and ask them to repeat it.
What TD?
So just like that, he's able to state again what it is that he heard. In this case, he didn't say the complete 3 letters, so there may be some hearing loss there. Now we're going to go into cranial nerve number 9, and we'll just go ahead and just briefly talk about it, but it's basically where the posterior third of the tongue, you assess if the taste is intact there. So you could use things like salt and sugar in the back of the tongue to make sure that he can decipher between the two. Now cranial nerve number 10 is the vagus nerve. Now this one you would actually have the patient tilt his head back just a bit, open his mouth wide, and then we would use a pen light to be able to visualize the back of the throat. You should be able to see the uvula and the patellar folds here, and you're going to go ahead and ask him to say ah. When he says ah, you should see the uvula that stays midline, and you should see the patellar folds that move upward along with the uvula all together, all at once, all symmetrically. So what I'm saying here is that yes, everything came up symmetrically, and then what you want to do is you want to take a tongue blade and place it down at the tongue and then have him gag, okay? So I'm not going to make him gag, but you know what I mean. So this also tests cranial nerve number 9, so just be aware of that. And also when you're testing cranial nerve number 10, just kind of hear if the patient's speech is a little hoarse or maybe has a nasal quality to it. That'll tell you a lot about that, about some impediment that he may have in the uvula, the patellar area. So stay very cognizant of that. So cranial nerve number 11, we're almost done, is the spinal accessory nerve. Now this one, we're actually going to be assessing the sternocleidomastoid muscles, which run here alongside the neck, and also the trapezius muscles that run alongside here, the back. So in order to test in order to test that these nerves are intact, we're going to go ahead and ask the patient to shrug his shoulders, and then we're going to put some pressure and resistance on it and ask him to keep it like that. So we were able to test those trapezius muscles. Now we're going to go ahead and assess the sternocleidomastoid muscles by asking the patient to turn his head towards his shoulder. Now when he does this, again, we're going to put opposing resistance there, and you can actually see when we put opposing resistance where that sternocleidomastoid muscle begins to constrict. And then we're going to go ahead and do the other side as well, and we see where that sternocleidomastoid muscle begins to constrict there as well. And then when you're doing this, you just want to make sure that you don't see any fasciculation spasms when you're doing this, or maybe when you're not doing it, just to make sure that that nerve is intact and you don't have motor neuron damage. Okay, and then the last one is cranial nerve number 12, which is the hypoglossal nerve that we will be testing. This basically has to do with the tongue. So what we're going to have him do is we're going to go have him stick out his tongue, and we're going to go ahead and assess that we make sure that he feels on both sides that tongue, and then we're going to ask him to move it right and left, and then just stick it out completely. We want to make sure it's symmetrical, and then go ahead and place your tongue back. And then we're going to go ahead and ask him to say 1 T, D, and N.
1 T, D, and N.
And when he says that, what you're testing is to make sure that the speech is intact, because the tongue's movement is also intact. And then we're going to go ahead and note that the tongue isn't protruding too much, that it is symmetrical, that it is the right size. So basically that would just be on inspection, make sure it doesn't have any tremors or anything like that. So that pretty much completes the 12 cranial nerves. We're going to go ahead and stop there, and we'll continue the next video on the portion of proprioception and cerebellar function. So tune in.